Hello, everyone. Thank you for coming in to the YouTube platform of Post Surgery Care of Atlanta. And I am going to be doing a video tonight. It titles Why Should You Become Physically Stronger Before Your Surgery? My name is Jillian, and I am the owner of Post Surgery Care of Atlanta, where aftercare matters the most. And I just want to make a quick announcement that this is our fifth year anniversary serving pre and post surgical patients in the greater area of Atlanta. So it's such a great accomplishment to have been in business for 5 years, especially going through the whole shutdown and still the pandemic is going on, but um, God has been so good, and bringing patients to Post Surgery Care of Atlanta for service to be done for them, and just really educating them and giving them the tools and giving them the just the guidance and just and the encouragement to know that we're here to stand with you, support you, and giving you all the information that we have to offer, and definitely always looking to um, build a library of what could happen and how to prevent certain things, prevent certain complications or just challenges, and knowing and having 5 years of data of servicing patients and different events that have happened. I definitely am very thankful that I started this YouTube channel to where I can really have these sit down moments and talk with my audience, and for my prospective clients that's going to be coming, or people who I may not meet um, in the near future, but they're going to get this video and more of the videos of Post Surgery Care of Atlanta, and to learn and to be able to know how to build their body for surgery, build their body for better health, for better living. And so I wanted to really start off with this statement: is approach your surgery as a physical fitness event, or a sporting event. Many times when we are getting ready for a concert, we go shopping. We make sure that we have our hair looking the way how we want to look. We have the outfit, we have the makeup, we have the shoes. We make sure that our transportation is on point. We make sure that we have our jewelry. We make sure whatever else whatever that needs to be in place, we're pre-gaming for the event of the concert. And we have to have that same attitude about preparing for surgery. We have to pre-game for the surgery. And pre-gaming is, number one, building of the body for the injuries that we're going to have that came from surgery. Anywhere there is a breaking of the skin, that is called an injury. So we want to have everything in place. We want to make sure that we are working out, that we're eating right, that we're putting the right things in our body: liquids, water, coconut water. Make sure we're getting in our proteins, fruits and vegetables, grains, minerals. We want to make sure we're doing all those things. But in this video, we're going to specifically talk about the physical body and getting it to become stronger. Um, from the 5 years that I've been in business, I have ran across some patients where physically their body was weak. They said that they work out, but obviously the type of procedure that they chose to get, it their bodies was not prepared to the level to take on 2 and 3 procedures that they got done. So it made it very difficult for them to heal at a more ultimate level as possible. in their body because they didn't physically build their body up to be very strong, to know how to conversate for the areas where they got surgery done, to conversate for those areas, to keep their body stable, to be able to have that strong core disposition, to be able to turn, to be able to do the things they need to do to get comfortable in different positions, because their body was very weak, and it took on other aspects of their mental and emotional state, to where they fell into they start experiencing depressive symptoms, and having anxiety because they were very unsatisfied with how their experience of the healing, and not so much that they were having complications per se, or infections, but it was just the fact that they felt really bad, because they didn't really build their body to be strong, which equals to their mental and emotional stability and endurance and stamina to be able to go through those rough patches of healing after surgery. And so we have to think of our body, we have to think of our surgery as an event, a concert, a going to the prom, as I'm preparing my body. I'm preparing for this surgery, this surgical event, to build my body to be stronger, to go through it, so I can minimize the pain, stimuli that are going to come if my body is not at its strongest capacity as possible. So the number one reason in why you should want to build your body to be physically stronger is that your muscles, your muscle tone is part of protecting you from future injuries that may happen, that will happen. Number two, you will feel stronger. You want to feel stronger and able to move your body when parts of your body has been operated on and now it has an acute injury. To be able to to maneuver the body safely and in the most strongest way for you to, while you're going through the toughest part of your healing process after surgery. Number three, third reason. I'm giving the reasons on why it's important um, to to build your body to be stronger before surgery. Number three is when your body is stronger, it increases the blood circulation for oxygen. It makes sure it ensures that the skin complexion is better. It makes sure that the cells respiration is moving at a more of a rapid pace. Um, it's you 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 will feel physically stronger in your body, to knowing that I've, I'm breathing a lot better because I've been working out, building up my body to where it is strong enough for the trauma that has came from having surgery. Reason number four is it reduces the soreness and cramps that come from surgery. It also helped with bruising because of the blood circulation. It will help where it will reduce the chance of as much bruising as it would be. Um, when you're moving, when you have to get up and walk around, it helps to where you don't have so much of the soreness because your body is moving at a faster pace of repairing itself, because it's knowing that, okay, we are stronger physically, to where our bones, our cells, um, our blood circulation, oxygen, everything is moving that's important to our body. It's saying we're moving quicker. Our cells are communicating to say we need to move faster to heal the body, because we have the tools to do what we need to do. The reason number five is when your body is physically stronger before surgery, it sends a message to the body and to the mind and to the emotions that I can get through this. I can get through this toughest moment in this after surgery. I have the motivation, I have the endurance, I have the stamina to go through it. The likelihood of me feeling as if I can't get through it is very minimum versus someone who has not built their body up to be stronger before surgery. Because working out is not just a physical advantage, it's also a mental and emotional advantage. Because when you are working out, I mean truly working out, breaking a sweat, getting their heart rate up, building up, moving those muscles, building up that muscle tone. You also are releasing out good hormones called endorphins into your body to say, I feel good. I want to do more of this. I feel good. I can get through whatever I got to go through. Whatever stress, whatever future stress that comes upon me, I am able to I'm able to handle it on a healthier level versus at an unhealthy level where I'm more easily prone to fall into the surgery blues of depressive symptoms and also anxiety of not wanting to get up, not wanting to want to eat, not motivated to have the the right state of mind of knowing that yes, I'm hurting, but it's going to be soon going to be over. Reason number six, it improves mood and emotions. Tied into reason number five, when you're working out, when you truly are working out your body before surgery, lifting weights, doing Pilates, yoga, weightlifting, body weights, when you're doing planks and different things to really strengthening and conditioning the body for surgery. You're also conditioning and bringing in an emotional stabilization before the future um, injuries of your body. You're able to build your emotional state to where when I get down to after surgery and I'm feeling bad, I have the endorphins, I have the mental stamina to know how to push through, to know that, okay, let me do what I need to do. Let me go and do my walking. Let me do my deep breathing. Let me make sure that I'm hydrating my body. Let me make sure that I'm speaking the right things over myself while I'm going through this healing process. But all that is part of building up the body to be stronger before surgery. Number seven is when you have physically built your body up to be stronger, you sleep better. Studies have been shown that those who actually have a well rested sleep the day after, they have better clarity in making decisions. They have a better their well-being is better. Emotional stabilization is much better because they're able to handle difficult situations more easily versus those who are not sleeping well at night. You'll be able to sleep through the night. You'll be less likely having those intermediate wake ups because your mind is just so busy with anxiety of the what if it's happened. You won't really have too many of those episodes of anxiety to the point because you have worked out, you have truly worked out your body and built it up strong enough to where it also has built up your emotional stability to take on issues in life, um, situations that are not so fun. Number eight, when you're working out, really truly working out and have built your body up physically to be stronger, you reduce the chances of you being in the hospital a lot longer. I know that a lot of the surgeries are now being outpatient out, where once they get a surgery, they go home. But there are still a good bit of, I know, medical necessary surgeries like transplants, um, open heart surgeries, well, any type of cardiac surgery. A lot of those are done in the hospital. Transplants are done in the hospital. um, Bariatric. Many of those are still done in the hospital where you'll stay for a few days. But even with that, if you have built your body to be physically strong, I mean very strong, if you are a patient that's going in for open heart surgery, let's say it may be a week that they're saying estimated that you will be in the hospital for 5 days. If you have truly have built your body up to be strong, very strong before surgery, you could probably cut that down by 2 or 3 days off to where it would have been 5 days without you not really building your body up, but because you've done the workout and you have done the mentally emotional workout with that to make sure that you are physically strong, you may cut it down to where you only in there for 3 days and you're out. And especially with the pandemic going on, you definitely want to build your body to be physically strong, to boost up your immune system during this time to where you're not putting yourself at any risk of potential COVID coming into your body or any other germs that are lingering in the hospital or even in the outpatient while you're there with your body being open or during this time of having surgery. So the fourth reason is it reduces the chances of your body contracting and drawing in. Many times I know from being a CNA, working in nursing home for many years, I have seen so many of the residents where their legs have contracted in, and many times because they're not doing any type of ambulation, no range of motion, not getting out of bed, walking around. And so when you have truly physically have built your body and working out, strength chain, training, weight lifting or body weight lifting, Pilates, planks, yoga, those things are really strengthening the body to be able to have a strong core disposition, um, to maintain your back, your abdominal, your upper body, your lower body, making sure that your lower body is able to withstand and give you the flexibility that you need. Anytime that if you need to make a quick movement or anything, you're able to do that. Or if you fall, you're able to bounce back up. Um, it's better for the body that you are physically stronger because memory cells are remembering times when you come out of surgery that hey, we know that our body needs to get moving. We know that our body has been programmed to move and to stretch out in a timely fashion. That okay, we're not we're not trained to sit in one spot and stay in one position too long because we know that okay, we need to be helping the body to get back into um, into a better position of knowing that okay, we're stretching our legs, we're getting up, we're walking. So it's a great way of letting the body to remember that we are flexible, we are not contracted, we are loose, we are not tight. um, Next, what I'm going to talk about is the type of exercises that are great for prehab. I know that we're used to the term rehab after surgery, after an injury or something where we're working on getting the body back. But when you have physically have worked the body out to become physically stronger before surgery, that's called prehab. To where um, these exercises that I'm going to give you are going to be great for you to do right now. Um, and what I truly recommend for people, if you can start working out 6 weeks before your surgery, and it does not matter what type of surgery that it is. It should not matter because, oh, well, it's outpatient. I don't have to do too much of this. Oh, I'm getting a breast augmentation done. I don't have to do. Anytime that you are preparing for surgery, it is your duty is to prepare your body to the best of your ability and physically getting it strong enough to where whatever that you're getting, that you're able to bounce back quicker. Because Post Surgery Care of Atlanta, we believe in faster, safer, healthier healing. And this is how you are going to be able to have that experience of a safer, faster, healthier healing is doing the pre-work, doing the exercise, really truly doing the exercise, not baby stepping on it, but really putting your body to work. Because how you work your body before surgery, it's going to serve you well after surgery. Um, the first one that I'm going to talk about is the hamstring, and I'm going to also explain you the benefits on why you should be doing these exercises. The hamstring exercise is great for overall leg flexibility. It helps with strengthening the lower back, which will prevent back pain, or if you are having back pain, it's going to reduce the chances of you having a lot of the pain stimuli in your back pain. The next one is the stretch leg rise. That is great for benefiting with the hamstrings, the hips, the lower back, the upper abs, and triceps. So it's definitely great again for flexibility, for core. It's great also for the upper body strength. The third one is the side leg rise. That is great for range of motion for the hips and keeping it rotating and keeping it nice and flexible to where you can open them, close them back, move your leg back or forward. Definitely great for hip rotation if you're getting a hip replacement. Um, it's great for body disposition to where giving the body more sturdiness to where you won't lose balance after surgery. Um, it definitely improves with muscle endurance, having a muscle tone, having the stability to endure injuries that happen to be able to repair itself even quicker. The next one is the standing hip extension. It is great for the pelvis area. Many times, I have not heard anyone really talk about the pelvis health and how it is so important, even when for ladies you getting tummy tucks or you guys who are getting ab work done through plastic surgery or if you're just getting abdominal surgery done, a hernia. Those things are so important in making sure that it's helping with promoting a safer, faster, healthier healing. It's great for also to give you that power for athletic performance for my athletes. Many of you all are prone to having orthopedic surgery. The standing hip extension is so imperative for you to truly be doing before surgery. So when you get out of surgery, it'll definitely give you that kickstart back and kickstart your healing process so you can get back to doing the sports that you love. The shoulder blade squeezing, that is one that is so important. I would say definitely for ladies and guys, if you are getting, again, if you're getting abdominal work done, area, if you are, um, if you're getting, if you have your lower part of your body getting surgery done, having a strong upper body disposition is so important. The clam stretching, that is great for um, the gluteus minimus and gluteus maximum. It's great for keeping the hips moving as well. Definitely a good way to kind of lift lift your booty up naturally. Um, um, I would say the next one is bridges stretching is great for with boosts of flexibility. And I'm going to tell you the flexibility portion of it. Many times people really ignore the flexibility. Flexibility is really does help with soreness, preventing a lot of soreness, and preventing also with um, with cramps. When you are very flexible, it definitely does prevent you of having where you may get a pull. Um, um, it is very important. So it's flexibility is not something that you should ignore, but you should definitely, that should be the top of your list in preparing your body, is making sure that you are stretching out your body to the best of your ability, like every day. We should be doing that anyway, but definitely when you are preparing for surgery, you want to be stretching out your joints, stretching out every part of your body. So when you go into surgery and come out, your body knows how to stay loosened during the times when you're not really able to do a whole lot of movement. It will keep you loose longer versus someone who has not been doing it, where you're going to be easily feel tight and restricted. Um, the next one is Pilates exercises. It is great for core strengthening of the body. Um, Pretty much is a way of body weight. If you don't have weights, Pilates is the best way to go to really um, making really strengthening and tightening up the body and making your upper body really strong. Because if the upper body is weak, it's going to be very difficult for you to be able to turn, for you to be able to slide out, to do things when parts of your body, when your abdominal has been worked on, for you to do things, because during that time, you cannot use your abdominal muscles. You're going to need to use your legs and your upper body to manipulate yourself in and out of the bed. Um, and the next one I'm going to talk about is yoga. That is great for flexibility. Like I said before, do not ignore flexibility, because flexibility is all intertwined with strengthening of the body, because you want your body to be very loose and flexible feeling and able, and it also helps with increased blood flow. It helps with making sure that nothing is no knots are in your body. Anything that's tense, it relieves stress from the body when you are promoting flexibility in your body. Aerobics, meditation, great for promotion of respiratory health, making sure that you're breathing properly to let out all the gas, carbon monoxide, but bringing in all the fresh air throughout the body. Aerobics is great for heart health, um, for any surgery that you're having, for blood circulation. It's great for relieving of cramps and tightness, stiffness, and relation, keeping you mobility as much as possible. Um, um, Water exercise, those are great, working in the pool at any age. Even for those who are much older, they're more in their golden years, 50, 60, 70 years old, and you may have to get hip replacement work done, or even for younger patients. The water is a great opportunity. It's a great way to where it's softened on the joints, but it's definitely still giving you that workout that you need to get that heart rate up, to get the blood flow going, strengthening of the body. Is so important. And last one is weightlifting. Um, I cannot stress it enough how important it is to lift weights, or using your body weight to strengthen your body, doing planks. Um, is so important, because being able to hold your body weight, being able to do a sideways stance is so important, because it's helping you with balance and holding yourself and giving you a better posture before you go into surgery. So I hope that you all enjoyed this video. I hope that it was very informative. I really took time out to really prepare for this video, because I wanted you all to really take this to heart. Please replay this video again and again and again. Even if you're not preparing for surgery, this is something that you should want your physical body to be stronger, because your body is like a bank, and if you're not depositing into it, there's nothing for it to give out when your body goes to surgery, or it gets hurt and it's waiting on to have to go into surgery. So give your body what it needs so it can give back to you. And so that's gonna be the last note that I'm gonna leave this video on. I didn't want it to go on too long, but if you all want to reach out to schedule a virtual consultation to talk more about how you can truly build your body for great success after surgery, to reduce the chances of emotional, mental complications, challenges that may come up, definitely you can definitely reach out to me. My number on my website is www.postsurgeryatlanta.org. You can book a virtual consultation there, and definitely go check on the company website. It's very comprehensive. It has everything that you can think of frequently asked questions, all the services that are on there, the pricing. So it will definitely be able for you to answer all of your general questions that most people will ask. Um, and after that, if you want to have a sit down conversation with me, definitely book a virtual consultation, and we'll definitely connect with you and set up a time so we can sit down and really dive in specifically on your needs, and how can we truly service you and prepare you for your surgery. And again, thank you all for watching this video. Please like, share, and subscribe to the YouTube Post Surgery Care of Atlanta channel. Definitely tell your friends about our channel. We are all about education. We're all about, having fun. There'll be another podcast episode that's going to be coming up very soon next month. So I'm really excited about the guest that's going to be coming on. And you all have a blessed night, and make sure that you heal happily. Talk to you soon. Bye.